So thank you for joining us for the vein screening seminar. So typically we do these seminars live and in person, but of course with COVID, we are limited by number of people in a room and so on. So we thought that we could get this together and get it online, both for present and future use. So we're talking about vein screening, and one of the first things that people think about when thinking about venous work is they think cosmetic. But in reality, it is anything but just cosmetic. And what we're going to do today is talk about venous disease, causes, symptoms, and treatments. So venous disease is very prevalent. Approximately 45 million Americans have venous disease, and that accounts for about 1 in 4 women, or 25% of women, or 1 in 6 men, about 15% of men, will have venous reflux disease. Of course, not all of people that have venous reflux have symptoms or even need treatment, but it is something to think about in terms of what can be the long-term effects of venous reflux. Less than 4% of those who have venous disease have ever been treated for their disease. And venous disease is actually 5 times more prevalent than arterial disease to the lower extremities. And the things that we want to prevent is, if left untreated, venous disease can lead to an increased risk of blood clots, skin color changes to your lower extremities, swelling, or even in long-term effects, ulcers that can sometimes take weeks or months to heal. So this is a slide that talks about venous disease, and you can see on these 5 slides just a wide variety of the way that these can present. Up in the top left-hand corner, telangiectasias or spider reticular veins, varicose veins underneath that, the big ropey veins that are underneath the skin. And as that gets worse, you can develop things like skin changes or lipodermatosclerosis, superficial phlebitis, which is actually a blood clot in the superficial vein, not in the deep vein, or venous ulcerations, which again can take weeks or months to heal. Some of the symptoms that are associated with venous reflux disease include aching, fatigue or heaviness in the legs, pain, throbbing, burning or stabbing is very typical, cramping, swelling, especially worse at the end of the day, itching, and even restlessness and numbness. Now, of course, these are a fairly broad range of symptoms, and they can be seen in other causes such as congestive heart failure, diabetes, peripheral neuropathy, those types of things. So part of the function of the vein center is to try and exclude those other causes sometimes from leg pain and swelling. So what are the causes of venous reflux disease? If both family members, both parents have had venous reflux disease, you have an 89% chance of having venous disease. So very prevalent in terms of heredity. Also age, unfortunately, venous disease increases with age in terms of the percentiles. And gender, women unfortunately are 3 times more likely than men to develop venous reflux disease. Part of that is due to hormones, but part of it is also due to pregnancy. And so, for example, women who have had 3 or more pregnancies are much more likely to have venous reflux disease because of the uterus compressing on the larger internal veins in the abdomen. Obesity, we are learning that there is a slight increased risk with obesity, and so this is something that we do look at. Trauma, so if there's a history of a blood clot, that can lead to increased risk of venous reflux disease. And standing or even sitting professions. So people who do a lot of standing, teachers, nurses, factory workers, or people who are at a desk job, those can aggravate venous problems. And we'll go into the pathophysiology of why that happens in terms of the valves and long-term pressure on the valves in a couple slides that'll show that.